Hello, it's Jen here. Today we are going to talk about knee pain. This is for all of you who have current or chronic knee injuries that you've been dealing with. This is separate from osteoarthritis or rheumatoid arthritis because those have underlying emotional issues that are different from injuries. So if you have or have had knee injuries, then we're going to talk about what the underlying emotions are and how to resolve those things so you can heal from them. So remember that your physical pains or other symptoms that you have in your body is simply your body's way of communicating with you and trying to tell you what's going on. It's a sign that there is something out of balance from within. And so when we look for these underlying beliefs or thoughts or emotions that might be contributing to these symptoms that we're having, we're not actually trying to heal something. We're trying to release a blockage so that the body can heal itself. The body is meant to be healthy and vibrant all the time, and so we just have to release those things that are getting in the way of the body doing what it naturally does best. And the particular thoughts and feelings that contribute to the knee problems that you might be having are not necessarily ones that you're consciously aware of. They may be things that you've only experienced once, or it might be something that is kind of a big habit that is a part of your way of being that you bring into all of the things that you encounter in your daily life. It may also be that sometimes the pains that we have are caused by emotions that we have absorbed or taken on from other people, especially if we don't have good boundaries. We tend to take on things from other people. This also happens a lot when we're children because we haven't yet set up those boundaries and we have these very close relationships with our family members. So it's very common to take on emotions from other people in the household that you grew up in. So just remember, as you think about the possible causes of the pains that you're having in your knee or whatever symptoms they may be, you are going to have to do some pondering to figure out if these things resonate with you and if they're true in your case, because they're not true in all cases. You need to see what your body in particular is telling you. And again, realize that you might not be consciously aware of having these feelings. You might have to do a little working to see where these feelings have come from. Okay, so if you have any sort of pain or injury or symptoms in your knees, what could that possibly mean from an underlying emotional standpoint? Well, one thing might be that you have a viewpoint or a feeling of being inflexible. The knees, for our body to function properly, for us to walk normally, to go up and down stairs, to do any bending or lifting, have to be able to bend normally, and they have to have flexibility in them. So injuries to the knees are very often about some variation of being inflexible, not wanting to bend, and oftentimes that's to authority. If you think of genuflecting, bowing, we often do that by taking one knee, and that shows that we're respecting or honoring some particular authority. So being inflexible, not being willing to bend, going along with that, of course, is stubbornness. And this often has to do with our pride or our ego. We don't want to have to let somebody else be right, perhaps, if we're being stubborn. So those are the main ideas of emotions or thought patterns that might be behind your knee pain. Now there are a few other things that you're going to want to consider as well to understand what might be true for you. Two questions. One, what side of the body are you having the knee problems with? And the difference between the left and the right side is true for most people. If you are left-handed, it might be reversed for you. So you'll have to do a little meditating for yourself to tune into yourself to see if this is reversed for you or not. But broadly speaking, the left side, we'll do it this way, the left side of the body refers to the feminine side, to women, to the mother, and to the idea of taking in and protecting. Okay? The masculine side is the right side. That, generally speaking, has to do with men, with the father, and to giving things out, and to letting go, and to fighting. So the feminine is the taking in, the giving part, the taking in and the receiving part, and the masculine is the giving out and the fighting aspect. The second question that you want to think about is, if you have a particular injury, how old were you at the time that it initially happened? And what was happening in your life at that time? Try to remember what other events might have been going on. What kind of stressors or experiences were you encountering at home, at work, at school, in any of your significant relationships? And all of these things will give you some clues as to what your particular symptoms that you are experiencing and what your body is saying to you is what your body is trying to say to you. So take all of these things, sit down in a quiet spot, and do a little bit of journaling, or if you don't want to write, just close your eyes and do some meditating and thinking on these things for yourself. Be willing to let whatever needs to come to you, come to you. If you find that you're feeling resistance to what I'm offering, then it means that you're probably just not ready yet to experience and explore this particular issue in your life, and that's okay. Everything will come to you in time when you are ready to allow yourself and ready to go into that and have that healing and learn that lesson associated with whatever healing you're going after to have at that point. So sit down and meditate upon what side of your body the injury is on. Is it acute? Did it just happen? Or is it something that's chronic that has been with you for years? Or maybe it's something that you keep injuring over and over again. Look for patterns in the symptoms that you're having within your knee. Decide if the things that we've talked about apply to you. Now, there's also another aspect of this. If it is the same side of the body as your particular gender, it may be about someone else of that gender, but it also may be an issue about yourself. So say you're a female and it's your left knee. Well, the left knee is normally associated with the feminine, with women, and with the mother. So does this issue of inflexibility in the left knee have to do with women in general? All women? Does it have to do with something specific with your mother or maybe a grandmother? Or does it have to do with you as the female? And then the same, of course, would be true for the masculine if it was your right side. So take some time to go through these things and figure out what resonates from you. Have a little conversation with your body and see what comes up for you. Now that you've done that process, of course, you want to release it and let it go so your body can have healing from this. One way is always to have an energy healing session, either a group session or a private session with me, and I'd love to help you with that. But ultimately, you want to be able to do this process for yourself on an ongoing basis. So the idea is to acknowledge and recognize whatever it is that is coming up at this time. Allow yourself to feel and experience whatever you are feeling. And if you need to, give it a name to identify it. You may or may not need to do that. The next part of the process is to choose to let it go and then to replace it with something else. Anytime we do any healing, and when we release some sort of emotion that we don't want anymore, we want to replace it with something else that we feel is more positive. If nothing specific comes to you, simply replace it with the idea of being flexible, of allowing things, of being healthy, or of being full of love. Otherwise, see if you can find a specific affirmation or a new thought pattern to replace whatever one you've let go of, and then just repeat that to yourself a few times while you're going through this process, and then use that affirmation for the next few days or weeks, however long you maybe feel is necessary, until you've accepted this new belief into your life. And again, remember, anytime you find any resistance to any part of this process, It means that you're just not quite ready to go there yet. And that's completely okay. Healing is not something that we do in an instant. It's something that takes time, it takes patience, and it takes a lot of compassion and love for ourselves as we go through the process. So I would love to hear from you about what you've discovered about your own knees if you've got injuries in your knees, and what you have found that you were able to release and let go of, and what you've embraced as part of your new pattern moving forward. Thanks for listening again, and have a fantastic day.